Have you ever been at the dentist and suddenly hear your hygienist calling out numbers like 323 or 212 and you're lying there thinking, what do those numbers mean? Well, they're not counting your teeth. Those numbers are measurements of your gums and they're part of something called periodontal exam or periodontal charting. And these tiny measurements can tell us a lot about the health of your gums and supporting structures around your teeth. Welcome back to OraCore. Today, we're going to break down what we're measuring, what those numbers mean, and why your periodontal chart is so important for us. Let's get started. First, let's talk about the word periodontal. Perio means around, and dontal refers to the tooth. So when we talk about periodontal health, we're talking about the structures that surround and support your teeth, especially your gums, periodontal ligament, and supporting bone. During a periodontal exam, your dental professional evaluates these tissues to look for signs of inflammation, gum disease, attachment loss, and bone loss. And one of the main tools we use is this tiny instrument, which is called periodontal probe. It might look a little scary, but it's simply a small measuring instrument marked in millimeters. So what exactly are we measuring? Well, your gums naturally create a small space around each tooth called the gingival sulcus, this area right here. Think of it like a tiny collar surrounding your tooth. During a periodontal charting, the probe is gently placed into this space to measure from the gum margin to the base of the sulcus or periodontal pocket. And that measurement is recorded in millimeters. This is called the probing depth. So when you hear 323, 212, those are not tooth numbers. Those are millimeter measurements. If you would like to know more about the type of periodontal probes, I made a video link in the top right corner. But why so many numbers? Here's something patients often don't realize. We don't measure each tooth only once. We typically measure 6 different sites around every tooth. 3 measurements are taken along the outside or facial side, and 3 more along the inside towards your tongue or palate. But why 6? Well, because gum health is not necessarily the same all the way around a tooth. One area might measure 2 millimeters, while another area on that exact same tooth could measure 5 millimeters. That's why you hear so many numbers being called out during your exam. We're essentially creating like a detailed map of your gums, and that map becomes your periodontal chart. So, what do the numbers mean? Generally, probing depth of about 1 to 3 millimeters are commonly associated with healthy areas, especially when there's no bleeding or attachment loss. When we start seeing 4 millimeters, we pay closer attention. A 4 millimeter measurement can occur with inflammation or swelling, but the number alone doesn't automatically mean you have periodontitis. And when we see deeper measurements such as 5 or 6 millimeters or even more, it becomes increasingly important to evaluate for periodontal disease. Deeper pockets can be harder to clean at home and might provide an environment where harmful bacteria can remain below the gum line. But here's something very important. We don't diagnose gum disease from one number alone. Your dental professional looks at the entire picture. And remember that bleeding matters too. While we're measuring your gums, we're also checking your bleeding on probing. You might have heard your hygienist call out like bleeding. Why do we record that? Because bleeding can be a sign of inflammation in the gum tissue. For example, someone could have relatively shallow measurements but still have gums that bleed easily. That might indicate gingivitis. So we're not just asking how deep is the pocket, we're also asking, is this tissue inflamed? And what about gum recession? Well, recession happens when the gum margin moves away from its original position and more of a tooth, or sometimes the root becomes exposed. And this is where periodontal charting becomes even more important. A patient can sometimes have a relatively shallow proving depth but still have lost periodontal attachment because the gum has receded. That's why your dental professional might evaluate something called clinical attachment level or CAL. These help us understand how much support around the tooth may have been lost over time. And remember, we also check more than pockets. A complete periodontal evaluation can include much more than probing depth. Depending on the patient, we may also evaluate bleeding on probing, gum recession, clinical attachment levels, tooth mobility, furcation involvement, plaque, calculus, and bone levels on your dental x-rays. All of these findings help your dentist and hygienist understand what actually is happening beneath the gum line. So, why is periodontal charting so important? Remember, the periodontal disease can progress without causing obvious pain. You may feel completely fine, your teeth might look fine in the mirror, but changes can be occurring underneath the gums. Periodontal charting gives your dental team objective measurements that can be compared over time. Think of it like creating like a baseline. If an area measures 3 millimeters today and later measures deeper, begins bleeding, or shows attachment loss, that's information your dental team can investigate. And if you have been receiving periodontal treatment, repeated measurements can also help evaluate your gums and how are they responding. And there's an important difference you should know. Remember, gingivitis is inflammation of the gums without attachment loss that defines periodontitis. It can often be reversed with improved plaque control and professional care. But periodontitis, however, involves loss of tissues supporting the teeth, including periodontal attachment and potentially supporting bone. That's why detecting problems early is so important. If you would like to know more about the difference between gingivitis and periodontitis, there's a video explaining everything in the top right corner. And remember, next time you're sitting in the dental chair and you hear 323, 212, you will know exactly what's happening. We're not just calling out random numbers, we're creating a detailed map of your periodontal health. Remember, 1 to 3 millimeters are generally easier to maintain probing depths when the tissues are healthy. But 4 millimeters means the area deserves closer evaluation. And deeper measurements like 5, 6, even more than 7, especially when combined with bleeding, attachment loss, recession, or bone loss, can indicate a periodontal problem that needs attention. But no single number tells the entire story. Remember that your periodontal chart, your x-rays, your clinical examination, and your medical and dental history all work together. If you learned something new today, like this video, subscribe, and follow OraCore for more about oral health. I will see you in the next video.